Hello and welcome to the Full Body Fix Coaching Show. Special warm welcome to my VIPs and my VIP family. And also we welcome you, our audience, our Full Body Fix member audience who are not yet VIPs. Welcome to you as well. We have an amazing show today. We have a good friend of mine and someone, when it comes to ocular health and ocular systems in your eyes, this thing that you see and experience the world through, she's someone I respect quite a bit. And if I ever need special knowledge in that area of the body, this is the individual that I'm going to go to. Now, you'll learn some things of why I say that as my opener and share with you as we get into today's show. But she's really interesting. I look at her kind of almost like a naturopathic ocular doctor, right? Almost kind of like that because of the way she looks at the ocular or eye system and her expertise, how she really addresses the whole body when it then comes to the eyes. And she looks at the eyes as an in-organ system that can really tell you a lot about your whole body health. And she's an expert. She's really one of the best experts in the country, in my mind, in terms of something called dry eyes, which is, it sounds kind of really basic, like, oh, you have dry eyes, like, use some eye drops, right? But there's so much more behind that we don't really realize, right? And I see my good friend here, Jeff Kennedy, he's on the show, and he was talking about how the trees are drying out because of droughts in California. And we live here in Arizona, where it's speculated that over 90% of people over the age of 50 actually have this dry eye disease. So that plus a whole lot more is what we're going to be getting into in today's show. And Dr. Alli Hoppert was a university professor for both optometry students, and she also taught medical students as well. And she's a fellow of the American Academy of Optometry, which only less than 10% of optometrists hold this designation. So with that, I'd like to welcome you, Alli, to our show. Welcome.
Thank you so much, Robbie. I really appreciate you. Thank you.
Absolutely. Yes. So to put you on the spot, let's start with what's a fun fact? Let's start with something fun. So the majority of our audience here today is around the age of 50 and over. Of course, we have some people who are really smart and they realize, oh, I'm going to start planning for anti-aging when I'm in my 40s. So we have the really brilliant ones that are in their 40s, but the majority are over 50. So, what would you say is an interesting fun fact that they should all know to get started with the show? And then I'll lead into some other aspects.
Just about eyes in general, about dry eye?
Yeah. Okay. Well, no, just eyes and ocular health. Like what kind of things
in general?
Yeah.
Well, I would say a fun fact is dry eye is probably one of the most common eye care conditions out there. It's, as a practitioner, it's one of the conditions we see the most, that I certainly see the most. But honestly, in the public, it's talked about the least. And I think it's also the most misunderstood in the medical community. So I think that's a fun fact. Lots of myths.
Awesome. So what would you say to get started? What would you say is the number one thing? What was the number one thing that we need to consider with our eye health? And does it change? Is it the same in our 20s and 30s as the 40s and 50s? And how does it change through the lifespan? What kind of things, for our audience that's over the age of 50 primarily, what kind of things do we need to start thinking? And is there differences between men and women? Right? This is really a loaded question, but I know you got a lot to share. So
over the lifespan, honestly, just like any other part of the body, it's so important to take care of your eyes and take a proactive approach, just like any other area in medicine. If we have any other practitioners on here, I'm sure they would agree that, it's better to be proactive than it is to be reactive. So having a good understanding about your body overall, and anytime you feel a symptom, there's a reason for it. So not brushing things under the rug is really important. And then just focusing on your eyes. If you have a problem, make sure you get looked into. And certainly getting your annual eye examination, that's overlooked in a lot of people. And a lot of people don't realize that the first eye exam should happen by age 1. The next one by age 3, and then age 5, and then annually afterwards. And that's because eye doctors check the health of your eyes, they check your vision, and they also make sure your eyes are working as a team. So that's a quick plug for primary eye care doctors. Over your lifespan, though, just like any other area of the body, there's a lot of changes that can happen with your eyes, certainly. In my area of interest, dry eye, certainly we know that dry eye increases with more birthdays with age. And previously we used to think that of the classic dry eye patient as somebody who is 55-year-old female, because women are a lot more predisposed to this than men, simply due to hormonal changes that we have throughout our lifespan. But now that's slowly changing, and we're finding that dry eye is really a condition that affects us all. It's what we call multifactorial. There's a lot of things that cause it. Age is one of them. Being female and hormone changes is another. But certainly there's so many other risk factors and lifestyle factors, environmental factors that come into play that put us all at risk. And now, when we used to think it was a disease for people more in their 50s plus, we're actually finding that it's affecting everybody. And we're starting to see some of these signs and symptoms clinically in patients that are much younger. I think I mentioned to you when we were talking earlier this past week that I had a patient who was 11 that started showing a lot of signs and symptoms. And again, that has to do to some of these lifestyle risk factors that we're seeing in patients.
So what exactly is dry eye? And is it, not to make a kind of pun, is it only on the surface, right? Is like, what exactly is dry eye? Is it just that your eyes are dry on the surface? Or, how much deeper does this dry eye thing go, and what can it tell us about our health?
Well, that's a really good question. I think I mentioned earlier, it's one of the most misunderstood conditions, and that's because patients, the public, and medical professionals think of dry eye as a symptom. And well, yeah, your eyes can feel that way. It's really not a symptom. Dry eye is a disease. It's actually a condition. And if we back up, and I just want to make this, just explain why this is important to everybody. If you think about the one sense that you wouldn't want to lose the most people would say it's their vision. So anything that's going to affect the quality of your vision, the comfort of your vision, the clarity of your vision, and generally good vision throughout life is something that's going to be important. And so any condition that affects your eyes that would affect this is important. And dry eye is, again, one of the most common conditions that can affect your vision. So why is that? Dry eye is, again, a disease, and it is a disease of the tear film. It's a chronic disease. And so what is the tear film? The tear film is the tear layer that crosses the front surface of the eye that protects all of those tissues. There's 3 layers of this tear film, and this is important to understand. A real thin oil layer out on top, real thick water layer that has all the salts and components we normally think of in our tears, and then a real thick mucus layer that helps to stick that tear film on the front surface of the eye. So think of it like a house, like a roof is the oil layer that keeps the tears from evaporating, that thick water layer that provides the nutrients, that has the salts, and then that thin mucus layer. And what happens is when those one or more of those layers become imbalanced, that's when dry eye is said to have occurred. And we care about this because the tear film is the first thing that light hits before light is directed to the back of the eye. So it always affects your vision. One of the most frequent symptoms patients notice is vision fluctuations or changes in quality of vision early on. That's one of the earliest signs, having to blink to see more clearly. Or you can even just watch someone if they're doing this a lot. That's a classic sign. So again, why we care, it does directly affect your vision, but it's something that it happens to most people. Anything that disrupts that tear film is going to start to cause that kind of cascade. And what happens when the tear film gets out of balance or loses what we call homeostasis, it starts to cause 3 things. It causes direct damage to the tissue. It causes inflammation, which also causes damage to the tissue. And it also causes changes to the nerves, which that's kind of a newer area of clinical research. That's a real hot topic. So again, direct damage, inflammation, and changes to the nerve sensation. So it's a hard condition for patients to understand, because if the nerves are affected, you can't always feel, you can't gauge your treatment based on how your eyes feel. And for doctors, it's hard too, because we have to try to coach our patients through that healing process and be able to show them that, here's actually what's going on, here's where you are, and then here's how it's improving microscopically. Walk that journey with me.
So is there something that we're like all doing that affects this tear film? Like,
absolutely,
is it sunlight? Is it blue light? Is it staring at screens too long? Like, is it not blinking enough? Is it having, I know we've talked about a lot of close distance work and not taking a break and looking. Yes. What is it that we're probably all doing that is totally affecting us potentially in a negative way that we don't realize, and some things that we can do to optimize that in our life?
Well, there's a lot of risk factors for dry eye. So before I answer that question directly, I do want y'all to know that I'll just list a couple here for you. So it's not just, again, that your eyes feel dry. These things contribute to this chronic condition. And if it's chronic, it's not going to get better unless we do something, unless we stop that damage from occurring. So the risk factors are, there's systemic diseases, other ocular surface diseases, certain medications for your eyes, having had certain eye surgeries, injuries to the eyes, lids, and face, incomplete or infrequent blinks, which you just mentioned, hormone changes, genetics, age, contact lens overuse and abuse, environmental factors, poor diet, lack of exercise, lack of sleep, inadequate hydration, excessive stress, anxiety and depression, excessive digital use, improper cosmetic use, and removal, and then certain cosmetic procedures, and then poor lid and facial hygiene. So I just kind of read my list that I have for my patients that I give to them. And you can see there that, well, certain things we can't change. We can't change our age. We can't change certain systemic conditions. We can get them under control, and that's important. But there are certain things that we can do for all of us. And again, all of us are at risk that we need to think about and address. So number one, I call it our environment and our lifestyle. We can break it down that way. So environment, anything that's causing what we call desiccating factors, basically anything that would dry your clothes on a clothesline. So high heat, high wind, low humidity. So being cautious of having like fans blowing directly in your face, obviously, making some of those easy modifications in your environment are important. Increasing moisture, so using a humidifier, that's important. So environment, we do have some control over, but lifestyle factors, those are huge. So with your lifestyle, I call it health habits and hygiene. So with your health, this is totally right up your alley. So with your health, Robbie, basically living a healthy life overall. You mentioned I take kind of that holistic approach. We care about lifestyle factors for our patients. We ask our patients about this because it really does matter. It does directly affect your eyes. So making sure that you are having a good, healthy diet. So basically anything that will cause inflammation in the rest of the body will affect your eyes. So good, healthy diet, be kind of geared towards more like the Mediterranean diet or just anti-inflammatory diet. You don't have to get crazy. Making sure you have adequate hydration. So it's recommended to have at least half your body weight or drink half your body weight in ounces in water daily. Making sure you're getting adequate exercise, blood flow, circulation, anything to decrease those inflammatory factors in the body. And then, of course, along with that, adequate sleep. That's how your body heals itself. Decrease and reduction of stress. Too much stress will release a lot of those chemical and hormonal factors that create inflammation, those inflammatory cascades. So getting all of that under control. So that's your health. And then we have your hygiene. So, washing your face twice a day, very simple, but a lot of people don't know this. you're actually supposed to wash your eyelids and lashes. And most people don't. They avoid the eye area. So when you close your eyes, just gently kind of rubbing in here and just gently really washing in a gentle circular motion around your lashes. That's huge. That's actually a fundamental part of our treatment is proper lid hygiene. And so that's important. Making sure you're washing your sheets and that type of thing. So that's doing a proper way, but habits, that's what we care about. So we're just about to get to that.
What, so like, is there a specific type of soap you recommend to wash the eyelids or?
Yes,
like,
yes.
I mean, is this like hand soap or
no,
what are we doing here?
No, well, and I want to address the habits section in a second, but yes, you don't want to use hand soap. No, something that's a gentle cleanser that's safe for your face. Typically, it'll say dermatology tested on it. Any gentle cleanser is fine, but when it really comes to your eyes, for all patients, again, this is one of the fundamental or cornerstones of our treatment, making sure that you're doing adequate lid hygiene. So something called a hypochlorous acid spray made for your eyelids is actually one of the simplest, most mildest, gentlest treatments that we can use. But there's several others, and depending on what's going on with your eyes, with dry eye, there are a lot of related conditions. Some people need something a little bit more aggressive to treat their lids and lashes and cleanse their lids and lashes. So that will be determined more by your doctor that's working with you. But I want to get to habits.
Do you have like any specific go-to products for the washing?
Yeah, I do. So again, it's called a hypochlor or hypochlorous acid spray. There's some eye doctors will carry them. If they're really into dry eye, they will. But a hypochlorous acid spray, like I like the brand Optase Protect is a particular brand that's really good. This is hypochlorous acid, sounds scary, but it's actually what your white blood cells make and release. So it's actually like antibacterial, antiviral, antifungal, anti-Demodex, anti-mite. So it's a real gentle, and it's just a spray. There's several brands out there. I personally, like I said, like OcuSoft, I like Optase, hypochlorous sprays, Optase Protect, but there's other brands too.
Awesome, cool. And then I'm sorry, sorry I interrupted.
Yeah.
Just because I know everyone's interested, like, well, what is the spray, right? So then you said you're getting into I think lifestyle factors.
It'll say it may or may not say hypochlorous spray on it, but if you look up hypochlorous spray, that's a really good one. So there's several out there. The one thing with them is they can break down quickly, and they break down into water basically. So you want to look at kind of the expiration date. So you want to get that balance between, how effective this product is going to be versus how long it will last, with preservatives, if that makes sense. Regarding habits, though, that's one of the biggest ones we can control in our lifestyle. So as far as lifestyle risk factors go. So blinking, digital use, we all of us are on the computer, on our phones, on our iPads, and this is so interesting. This directly relates to your eyes. It directly affects and impacts your eye health, in particular the front surface. And so how does it do this? They have actually done studies on this. So one study said that your blink rate decreases from about 18, 19 blinks a minute down to about 4 to 6. Another one said your blink rate, your involuntary blink rate, decreases to about 80%. And why do we care? Well, we care about blinking because remember I said there's those 3 layers of the tear film. That oil layer is the top layer that keeps the tears from evaporating. Every time you blink, you have about 50 to 70 specialized oil glands in the eyelids that release oil into that tear film. And that's what keeps the tears from evaporating. So if we're blinking 80% less, we're getting a lot less oil into that tear layer. And that's going to cause some problems. Our tears start to evaporate. And when you think about it, when you're on a digital device, you get so honed into what you're doing. You don't actually, a lot of times, like if your eyes start to get a little irritated, we kind of brush that under the rug. We don't really think about that. But what's happening is when we don't blink enough, that oil gets kind of impacted. It gets kind of backlogged into the gland. It gets impacted. It starts to turn more from like an olive oil consistency to like a butter consistency to like a toothpaste consistency. And then it gets really plugged up. And then the gland actually gets completely what we call blocked or obstructed, and then it can drop out and die off. And once that specialized oil gland, they're called meibomian glands, once that oil gland drops out and dies off, there's really nothing that we know of yet that can help it to regenerate. There's some preliminary treatments where they're kind of looking into it right now, but there's nothing for sure out there. So why do we care? Well, this is impacting people directly. There's some other medications and things that can affect the glands. Certain products can too. So just an aside, watch retinol products around your eyes themselves in cosmetics and in your skincare. But the biggest thing is blinking, making sure that you're blinking properly, blinking enough. And that's just, we don't think about our blink. So digital use is the biggest issue with this. And it's such a big issue that we're now seeing it in kids. Think about it, with COVID, all the kids were online in school. And now, if there's any eye doctors out there listening to this, I would invite you to start looking at your kids' glands. Your doctors have been asked by the academy and other professionals teaching dry to make sure that you're going and pushing on those glands when they're examining patients. And now I recommend doing it in kids too, not just adults, because we're seeing these changes, drastic changes in kids.
And one thing I found especially beneficial is, and I have a very funny, or actually a very interesting, and then also some humor to the story as well. But that's coming next, so stay tuned. But so one of the things I thought was really interesting is what you do with, you mentioned the blink more, but you also mentioned based on how much X amount of screen time should include X amount of looking at least 20 feet away, right? Mm-hmm. And closing the eyes for 20 seconds. So there's like a 20-20-20 rule. Yes. So tell us more about that and exactly what's going on in that, and what is the kind of physiology that happens in the eyes with that?
Yeah, so that is known by eye doctors as your 20-20-20 rule. It's corny, but it helps patients remember. And so this is really important for all digital users. Every 20 minutes, look 20 feet away for 20 seconds. And the reason for that is the 20 minutes, again, we need to take those visual breaks. 20 feet, the reason that matters is because in order for your focusing system inside your eyes to relax, it needs to actually look 20 feet away. If you're in a small room and you can't look out a window, there's a muscle inside your eye that's constantly squeezing. And the closer you're looking, the more it's squeezing. The only way to relax that muscle is to look out 20 feet. So look out a window every 20 minutes and do this for 20 seconds. So it's the 20-20-20 rule. And I encourage during that time to do what we call blinking exercises. Take a few moments to close your eyes, squeeze, relax, squeeze, and open. And you should feel more wetness on your eyelids when you do this. And this, again, kind of forces the oil to naturally flow. Because when those glands get blocked, again, we want to be proactive, not reactive. We don't want to wait till the glands are blocked and you have symptoms to do something about it. We want to prevent those things from happening.
So just doing this simple task, right? It's every 20 minutes with screen time, especially how effective is this for preventing a lot of degenerative diseases in the eyes?
It's huge. So degenerative diseases, that oil gland problem I was talking about, those meibomian glands, the disease is called meibomian gland dysfunction. And that is one of the leading causes of dry eye disease, the leading causes of causing that tear film to get out of balance. In fact, 86% of patients with dry eye have that MGD or meibomian gland dysfunction. So that's huge. And that's an issue.
That's huge.
And in order to work on it, one of the biggest things to do is really, it's free, it's easy. It's just working on your blink. Think about your blink. And it makes a difference. Actually, it's so much of a difference that as part of my treatment regimen, we do in-office treatments, we do home therapy. We also talk about those lifestyle changes and then also monitoring patients. Those are the 4 elements of the treatment plan When we look at home therapy regimen, I actually prescribe blinking exercises. That's how important it is. And I give patients a sheet with how to do this. There's also an app for it, the Donald Korb blinking app. Donald Korb is one of the leading researchers in dry eye disease. So he's very well known nationally and internationally. So if you look that up, you can find it.
So it was amazing. Patricia, if you come on with us as well. So this was like 3 years ago now. And, you know, we had gone to our eye doctor at the time, and she was told that, what was the story, Patty? Basically, you're told that you had rheumatoid arthritis, that you have potentially, which she's totally does not have, the lifestyle, genetic factors, family history, anything for rheumatoid arthritis. They've told her she has so many potential other diseases. She had to go from the regular optometrist to another specialist, and she went through this whole process. So Dr. Alli has been a client.
Hold on. You forgot the brain tumor that they told me I had.
Yes.
Okay, so the story is, I was having a super crazy problem with my eyes that it started getting so bad with light sensitivity. I couldn't work. I couldn't watch TV. I couldn't even go out. I couldn't drive because I couldn't see. I had to be wearing this super heavy sunglasses at home. They were super dark. And another type of glasses that I got at the ophthalmologist place, that was that black, that I look like a blind person. Okay, when Robbie and we went to church on Sunday, and I had my sunglasses and the super dark shades, and I was looking down because the lights are just too much for me. And I was thinking, man, people are probably feeling so sorry for me. Oh, so young and blind. So I couldn't do nothing, and people were diagnosing me with all this very random disease without having a blood exam, with completely irresponsible. I would go to the eye doctor. Oh yeah, you may have a brain tumor. Oh, you have what is the name, Dr. Alli, of the retina? Autoimmune disease.
There's a lot of autoimmune diseases that can affect the retina. So I don't know. I'm not sure.
One of those, go to the retina specialist. And I went, and she told me, oh yeah, you have an autoimmune disease in your retina. And I'm like, man, what's going on? And then I went to see Dr. Alli after 3 months. This was 3 months that I couldn't do absolutely anything. And I will be forever grateful to you, Dr. Alli, because in the same visit, you told me to put eye drops, and that eye drops saved my life. In the same day, I put eye drops in my eyes, and next day I was good. I am from Brazil, moved to the desert. So none of those specialists thought about, oh, she's used to humidity. Now she lives in the driest place in the world. She may have dry eye.
Yeah. And this is a great example, because people, again, dry eye doesn't sound like that big of a deal, but I hear this stories like that all the time, all day long. And when the symptoms, we kind of just brush the symptoms off, like, oh, it's a little dry. And then just know that it's a chronic condition. So if you do that, it will continue to the point where it's that frequent, and it'll start to cause problems, and where it affects your function. And so why was it doing that? Well, remember how I said that the tears protect your eyes? The tears are important because they protect that front surface, the cornea. The cornea has the most nerves out of any tissue in the body. So if the tears are evaporating too quickly and that those corneal nerves are exposed, they become kind of raw. We may not have actual dry patches yet. We've got to do a lot more testing and talking to the patient to figure out what's going on. But light sensitivity is one of the major symptoms, signs and symptoms of this condition. And it can be for other things too, absolutely. Autoimmune conditions definitely can be related. In fact, there's a lot of systemic conditions, but there's just simple things. We want to try to rebuild that tear layer, and even just simple steps. So yeah, I'm glad you're feeling better.
Yeah, It's kind of funny. This definitely wasn't part of Patty's condition, but it was pretty funny because Patty is not part of the science team, right? She's part of the technology team and she's brilliant there, but she's like, just tell me what to do. I don't want to know all the science about it. She's that individual. So when she went to see Dr. Alli, so what kind of eye drops are you using? Oh, I'm using this. And they're ear drops. So she's using ear. She's like, well,
Nose drops.
Nose drops. That's right. Nose drops. Yeah. So she's using her nose, and Dr. Alli is like, no. You can't be using your. I'm like, I did tell her. I said, I really don't think you should be using your nose drops for eye drops. It's not a good idea. So yeah, that's also a very funny part of that whole story.
Yeah. And I should say, like, it again, it's chronic. So it's not, the symptoms aren't going to go away. If you start to have that, and I think the key is if you're starting to notice symptoms, if we don't do something about it, I would hate to, have you sitting here a year from now wishing your eyes were feeling like they were today. Because again, it's not going to get better on its own if you're starting to have symptoms. And the other thing is here's another thing. If you're a contact lens wearer and you cannot wear your contacts comfortably for at least 12 hours, multiple days in a row, you need to get that under control. You need to have that looked at, because again, it'll get to a point where you won't be able to wear your contact lenses. So those are just those two key points. In regard to Patty's story, again, it's just, I hear this all day long, and I've worked in primary care optometry. I've, done primary eye care exams for 11 years. And I finally just opened up my own dry eye facility, and I only exclusively focus on these conditions now because it's just so frequent. And there are so many tests and things that need to be done to truly determine what's going on. In addition to dry eye, oftentimes patients have 3 to 4 conditions that are being caused because of it or that contribute to it. So most patients have 3 to 4 ocular surface conditions going on at the same time, causing similar symptoms. And we know that their corneal nerves are affected. So you need to have someone out there who's got all of the proper diagnostic equipment, that passion and that time to really spend with you to look into it and to see what's going on and get to the bottom of what's going on. I have patients that wear goggles to bed, and that's important. We even prescribe that. But some patients I've had a patient cellophane her eyes shut. I mean, she's so uncomfortable. I had patients like Patty that have to wear sunglasses indoors all the time. I've had patients that have to have their shades drawn in their house all the time due to this light sensitivity. I've had patients that couldn't go on vacations. I mean, it's not even just like I have to stop doing what I'm doing or stop doing a task or decrease computer use. It's really to the point where it affects life, like Patty was saying. So we don't want that for anybody.
Yeah, and I'll have to say it's my last visit with Dr. Alli was like 90 minutes, right? I mean, I'm with her for like 90 minutes and we get into all these deep discussions, and the level of eye exam I've never had in my life. You're truly amazing. You really are excellent at your craft. Yeah. And now let's turn first. So the order of which we have questions is our VIPs, of course, they have exclusive first dib access to our experts in the Full Body Fix show. So VIPs, I'll ask your questions first. If you have written questions and you don't want to connect on the video, that's fine. I'll ask your questions for you, but please, I'll go in the order of this. Those VIPs that raise their hands, they're first. Next, I'll ask any written. I'll try, and Patricia will help me make sure any VIP written questions will go into that, and then we'll go into our open audience questions. So first up,
good questions down here. I'm seeing lots of good questions.
Yeah, it's always fun because then we're able to really get into, what is the areas that they're most interested in. So Randa Haynes, good afternoon, actually evening for you, right? Good evening for you.
Yes. Hi. I wish you were in Paris, doctor. I would love to go see you. I haven't found anybody like you. I wanted to ask, what is there significance in, if you have, can we go off the subject of dry eyes? Do you mind if we ask other kinds of questions? Sure. If you wear progressive lenses, and how significant is the brand name in terms of the way things are organized within the lens? I've just recently got convinced to change the brand that I had worn for 20 years because everybody said it's not sophisticated. There are much more sophisticated ones. And I've tried the new one and I feel like something's not right, but it's very hard to put my finger on it.
Yeah.
So
You
how
hit the nail on the
important is
head.
that? Yeah.
Yeah, it's important. There's thousands of brands of progressive lenses out there, and that's another major myth in eye care. I would say that the brand is actually what we call the design of the progressive. And so those viewing zones, the distance, computer, and near, are going to be arranged according to a proprietary design based on the brand that you select. So there's a lot of factors that can go into how your vision feels. I could do a whole hour just on that. So what I would recommend doing there to help answer your question best is, if you're having those types of troubles, it's normal to have those kinds of sensations to your vision the first 24, 48 hours afterward. But if you're still experiencing those troubles, go back to where you got them. And they actually should be able to take a little marker. There's little etched markings. They can mark them up, align them, and actually make sure that things were made properly and they're adjusted properly, sitting properly. And that's huge. That's the number one thing, making sure the adjustment's right, then making sure that they're ground properly. And then they can look at the brand.
Mm-hmm. Thank you.
You're welcome.
Dr. Alli, don't you do something online for those that are not in Arizona?
Yes, I do things online. We're with my office, we'll be opening up the telehealth appointments soon. And so I will have consultations for patients. It's not going to be able to take the place of that full 90-minute dry eye evaluation that Robbie was mentioning. But certainly we can go through the extensive history, the risk factors. We can talk about your particular lifestyle modifications, products you've used, products you've tried, and we can at least kind of try to tackle things in more of a stepwise fashion that are specific to you and your case. So I do have patients that fly in to see me and come in from other places, certainly if you're in the States, but if you can't, I get that. And I'm hoping to do more of an outreach here shortly.
Where are you?
In Phoenix, Arizona.
Oh.
With Robbie, yeah.
In the dry zone, yeah.
Yes.
Yeah, very dry zone.
Do you have an opinion on using, it's called low micellar, it's a micellar water?
Yes, I use that all the time. And actually that's what I use in my clinic. So if you have beautiful French pronunciation. I love that. But here I call it micellar water with my Midwest twang. And yes, I use that. So there's several different products and brands. It's MICELLAR. And that's what I recommend for makeup removal. And prior to
cleaning the eyelids. Yeah.
Yes, that is excellent for cleaning the lids from makeup. That's what I personally use. And that's also what I use prior for many of my procedures for my patients on their eyes, skin, and face.
So if you use that, do you also recommend using that spray?
Yes. So I would do the micellar water to cleanse. And then afterwards, you close your eyes and you do that hypochlorous acid spray, whichever, make sure it's for the eyes.
Yeah.
Because there's some for your hands, there's some for cleaning, like the house. So just make sure it's the right concentration, it'll say for eyes. And yes, because that will be more, and you let that air dry. That's more like antifungal, antibacterial. So cleanse first, get rid of the makeup, and then use that protection.
Thank you.
Great question. Thank you.
As always, great questions, Randa. And yeah, so when Dr. Hoppert gets her telehealth structure, we'll all post in the VIP family to let everybody know. And of course, feel free to stay connect with me on that, and I can connect you directly with her. So absolutely. And then our next VIP is Janie. Hello, Janie.
Hi, Janie.
I think she lowered her hand.
Oh, she lowered her hand.
Yes.
Oh.
Actually, I think she's logging back in. So
She's logging back in. Okay.
Yeah.
So let's see. Let's bring her right back on. Okay. If we can. If you can bring her up with us, Patricia.
Yeah, I'm looking for her. Okay. Oh, she doesn't have, let's go to another VIP.
Okay, so let's go to Lucy, and then we'll send her a message, if you would, Patricia, a private message, then we'll get her back in the running here. Hello, Lucy, welcome.
Hi. Because of my constant health issues with the cherubism and the cyst pushing on my eyes, I had a cyst behind my left eye. And since it's gotten removed, my left eye is chronically more dry. Would there be a reason maybe for it? Because I'm trying to help. Like my optometrist told me to do put eye drops in 3 times a day.
Yeah, this is now when you say you had a cyst move behind your eye, are you meaning on your eyelid?
No, it was a cherubism cyst. It's actually a rare disease, craniofacial disease, and it was like a bony, bloody cystic cyst that was right behind my eye and went actually underneath my eye, and it took over my orbital bone. So I don't really have an orbital bone really on my left eye. Underneath my left eye, he left just enough bone there to hold the eye in. So, but my eye has been like hurting, and it's been really dry, and because of COVID, I haven't been able to see anybody. I can't wear a mask because I have other problems going on there with my breathing. So yeah, it's been really hard to see anybody because of it. And I just don't know why my eyes are more dry than before.
Okay, there's so many reasons for this, so I'm going to try to be as concise as possible. The number one thing that would strike me about your story is after a surgery, depending on exactly what they're doing and how it's affecting the lid, if anything is affecting the true closure of the eyelid or the tissue inside the orbit itself, which in this case, it sounds like the tissue is being adjusted. So what's going to happen is it will ultimately affect your ability of your lid to close, especially if they're removing that orbital bone. Anything that affects the ability of your lids to close completely or seal completely, especially while you sleep, or just normal everyday use, like as you're sitting there blinking, if your lids aren't meeting because of the tissue is being changed or repositioned, even behind the eye, it's going to affect all the contents within and how your lids close over it. You'd be surprised how just about a lot of surgeries, not all, but many eye surgeries can affect lid closure. And that right there is one of the major 7 categories that I look for in my clinic. So again, I look for oil problems and water problems in the tear film, but eyelid function, eyelid abnormalities, and eyelid closure is another one of those major categories. And so I'm not shocked that after a surgery like that, you'd be feeling those concerns. When your doctors say use some eye drops, this is one of the things, again, and that's again, in the medical community, this is what we often, tell our patients. Well, not just any eye drop will do. Not all eye drops are created equal. And I would actually like to back off from that and just say too, in the dry eye world, the dry eye specialist, we actually, eye drops is just kind of a basic thing to help you feel a little better and soothe those corneal nerves. But true treatment, there's much more to it. And that's more of just helping how your eyes feel. I think the bigger issue is protecting what's there and getting to the root cause of exactly what's causing your eyes to feel that way. We want them to feel better, but we want to fix the problem. Sounds to me like a lid problem. So lubrication is important to make sure if your lids aren't blinking all the way down, or if the surgery somehow affected some nerves that affect lid closure or lid seal, that's important. There are some masks out there. I would try, it's called EyeEco, EYE-ECO. EyeEco is a company that makes some really great, what's called moisture chamber goggles. And there's silicone medical grade that will seal around the eyes completely. There's clear ones and there's colored ones. You can put a little bit of like distilled water in it, even to create a true moisture chamber. If you're in an area a lot, like sitting at a desk or in a, in your living room, or, you can try keeping humidifiers by you. Any drops, again, most of the time drops are going to be helping with just comfort. There are some that are definitely medicated out there and helpful. But drops, even over the counter ones, should be prescribed for specifically what you have, and anything that you use should be preservative free if at all possible. So not just any eye drop, it's got to be preservative free, either in a multi-dose vial or a little tiny vial. A lot of stuff. Sealing, using those moisture chamber goggles and preservative free drops. There's also some great gels out there as well.
Thank you for that, Dr. Alli. And on to Jeff. Hello, my friend. Welcome.
Hi, Jeff.
Jeff had he sent in our VIP family today a message. So we have all of our VIPs connected in the same WhatsApp group. And he had 100-foot tall ponderosa pine fall. And actually the very top of the tree hit his house, broke some of the roof a bit, but he was actually in the area of the house that the tree fell, and it didn't smash the house enough to cause any physical harm or any dramatic house damage. And that's amazing. Yeah, very, very, very well.
Yeah, I think I'm down to about 6 of my 9 lives.
Yeah, on that one. Yeah.
Yeah. In any event, so some deep background. When I was a kid, I was plagued with sinusitis. I used neosynephrine a lot. And during the grass pollen season in particular, but also some tree pollen like yellow acacia, I'd get really bad reaction to the point that in the morning I'd wake up and my eyelids were sort of welded shut because there was this yellow, crusty liquid, clear kind of liquid that had congealed and was holding my eyelashes together, and I'd have to manually break it off, and then I could go about my day. Well, I grew out of that. So fast forward now to the present, I just turned 74. And the last couple of years, I've had a kind of dry eye, I guess you would call it, but mostly in just one eye, mostly in my right eye. And my right side, for some reason, tends to be more congested eustachian tube and ear chamber than the left. So I'm wondering what your reaction to that is. I do use a product called Refresh Tears lubricant eye drops. And when I get the symptoms, which is a sort of a cloudiness, and if I close my eyelid and massage it, I can, and if I go from inner side, tear duct side out, I can sort of push this film of gunk off to one side, and then I have good vision again. But it's not constant. I'll go weeks without a problem, and then it will sort of show up. So what's with the asymmetry, and what can you tell me?
So many good points there. And again, I hear your story a lot too. Remember how I just said there's 7 different categories of the conditions that I look into? Allergies is one that absolutely contributes. So we look for water problems, oil problems, lid abnormalities, allergies, and also something called blepharitis or bacteria. So like bacterial overgrowth, microorganism overgrowth is another huge category. So you described in the morning kind of waking up with that kind of like yellow goo, if you will, on your lids. Oftentimes that's related, not always, but oftentimes there is a microbial component to that. And in fact, we address that in all patients who come to our office. Everyone gets talked to about that because all of us have risk or have that going on. As far as the allergies go, that's interesting. And so they contribute. Asymmetry, now that's a loaded question. And there's a couple of reasons for asymmetry in these conditions. Can be anything from, number one, remember how I said with dry eye, it affects the nerves? Well, sometimes some patients have really bad signs, but no symptoms. So sometimes it affects the corneal nerves not
Asymmetry.
similarly. Thank you. I can't spit that out this morning. But basically what's happening is you may have, and I haven't evaluated you, you may have the condition the same amount, but it's how you feel is being affected in one eye. So the nerves could be an issue being affected in that manner. The other thing it can be is blink. So again, for everyone, we evaluate how their lids meet and how they blink. And some people, many people, don't blink the same. So you might have one lid that doesn't meet all the way or close all the way due to whatever condition or concern. That would be, again, something we kind of ferret out in the case history. And it's often things your patients aren't aware of. That is very common in asymmetry. So nerve problems, lid problems. And then the other one, and this is more of a functional thing that can cause asymmetry. What side do you sleep on?
I try and sleep on my back, but
Okay.
if I choose to sleep on a side, I sleep on my right side. And I think it may have to do with, I have a congenital 10-degree kink in one of my lumbar vertebrae. So it's not a bend, it's actually an angle. And I think it's easier for me to lie on my right side. So stuff would drain into my right ear.
Yep. And it's interesting because in those patients, sometimes when I see that microorganism overgrowth, oftentimes it's on the side that they sleep on. And so again, I would have to know a lot more about your history, and that's a 90-minute eval. But those are three of the things I would automatically kind of start to go to, habits, like what are you doing on that side and what time of day is it? So changing your pillowcase more frequently, try that. It can be allergy. There can be some congestion related things as well. So getting those allergies under control, because again, if it's all kind of in the sinus and it's draining to a particular side, that can affect your eyes. It actually affects the conjunctival tissue. So it could be, again, allergy related. It could be just physically the side you're sleeping on and what you're exposing that eye to. It could be the lids meeting, and it could be nerve. So technically 4 things.
Yeah. So a couple things. Even though I'm right hand, right leg dominant, I'm left eye dominant. And by that, I mean, I'm really into photography. So when I bring a camera up to look, I look through my left eye, not my right eye. And I don't know if that has anything to do with the neural connection, but
it's a great question. We do actually see that. It seems counterintuitive, but it does happen. Not as common, but it happens.
Right. Then my wife, not recently, but quite a while ago, had a condition called Blepharitis. And she was prescribed Johnson & Johnson baby shampoo as the shampoo to use to clean her eye duct when she was massaging it, and seemed to work for her.
So traditionally, those are called lid scrubs, and that's part of the lid hygiene regimen. The traditional treatment was with baby shampoo, and that worked. So Blepharitis is the old school term for kind of bacterial overgrowth, but it can also include a lot of other things as far as the oil gland plugging and things goes. It sounds like they're talking more about the traditional Blepharitis, so the bacterial component. So traditionally, the baby shampoo lid scrubs are kind of all we had. That is definitely morphed, and there's a lot of new changes on the market. My first go-to just in general for everybody is the hypochlorous spray. And then after that, people were using tea tree oil products. There's a lot of tea tree oil cleansers. I've even moved away from that one now. There is an amazing product out there called, the company is called Zocular, Zocular. And it's made by an ophthalmologist out of California. The product is okra based. So it's an essence of okra, and it does not sting like tea tree oil. Don't put tea tree oil directly in your eyes, by the way. If anyone's hearing that, don't make your own. You burn your corneas. But tea tree oil is very irritating. One of the developments with Blepharitis over the last 10 years is oftentimes it's called Blepharitis, but the most common form is actually a very specific kind called Demodex. And Demodex is actually, and this is a little off-putting, but it's, all of us have this, it's a mite, a little skin mite.
Yeah.
And it really needs something more than the baby shampoo. So if it's just kind of the general like bacteria, we might be able to get rid of that with the simple cleansing. And that's what I was talking about earlier. Everyone forgets to wash their eyelids and lashes. So we can help the majority of people out there just by kind of keeping that micro, the micro bacteria, all that stuff down. We can keep that bacterial load down just by cleansing the area. But when it comes to Demodex, you need something a lot stronger. So for those of you watching, Zocular, I would try that, the Zocu foam or Zocu wipes, and you can get those online.
And then very last thing, I underhydrate, and I find drinking a lot of water to be work. I rarely do I drink out of thirst. I drink out of, yeah, go ahead.
Jeff, what size bottle do you use?
It varies. The one I use when I'm trekking is, I think, 22 ounce.
Yeah. So, I mean, well, especially if you're trekking, that's actually really small. So what I suggest, one of the best ways to increase your water
22
intake
ounces is small?
Yeah, absolutely. Yeah. And so to have like a half-gallon jug, right? Like all the people that I know that drink, like most of my work is from home or the gyms in the house, everything. But so I have water immediately available. And I think a lot of your time is in the house as well. But long story short, even in the house, if you have a water drinking issue, you want to get a bigger jug because, you know, if you're drinking a smaller bottle and, you know, oh, I drank a bottle. Okay, well, you're like 10% of the way there for the day. But if you have a half-gallon jug, then it changes the paradigm. It changes the perspective of how much water then you know, oh, I need to drink X amount. And then I don't know if you've heard me share this before, but really the best way to figure out and test your hydration minus a multivitamin, right? Because there's
your urine color.
Yeah, exactly. But minus that, look at your urine and you want to be clear-ish to light yellow, clear to light yellow. You know, and like when we start with the physical fitness scorecards, we're going to be assessing this on a fairly regular basis. But clear to light yellow, look at your urine, and every time you see that urine go past a very light yellow, you should go, oh, I need to drink more water. I need to bring it back down to light yellow. So between a big jug and your urine color, I think just those two things are going to help you really change your paradigm and thought process around water.
Okay. Thank you very much.
Thank you.
And next up, we have, and our next VIP is Kathy Ramsey. Hello, Kathy. Welcome.
Hi, Kathy. Oh, I think she's muted.
Yeah, you're muted. Let's see. No, you're still muted, Kathy.
Oh,
there we go.
I thought maybe you had control and I didn't.
No.
So my history with dry eye or related symptoms goes back a while now. I had cataract surgery about 2003, which is kind of early, but I was told that maybe it had to do with the fact that I've lived high elevation Western US most of my adult life. That may or may not have anything to do with it. My diet's been bad too. So anyway, I had dry eye then, shortly before surgery, but the symptoms were very different than they are since the surgery. Back then, my eyes were constantly tearing up and blood red before the surgery. Since then, they just seem to be, quote, chronically dry. I am an under drinker of water. I know that. But I've also been diagnosed with low thyroid. And of course, I'm postmenopausal. And my current eye doctor, she's tried to help me with this. And at first she gave me a sample of some prescription eye drops, which I don't recall what it was. But since then, she's only, she's completely backed away from, prescribing that any further for unknown reasons. And so she prescribes omega-3s and then these warm up rice packet eye masks. for at night, like when I'm supposedly laying flat on my back, which is not normal for me. I'm working on that. But and I don't routinely use over-the-counter eye drops, but I'm constant, and I spend way too much screen time. I know that, and I'm trying to break myself away from that. And I just retired, so it should be easier, but so far it's not. So what is your opinion about how helpful omega-3s are, and dry warmed up rice packs? And you know, is there something more that my eye doctor could be doing for me than those suggestions?
Great, great. Thank you for bringing that up. And again, like your story, I hear this every day too. Gosh, lots of risk factors there that you mentioned. And just before I answer your question about what we can be doing, just so you all know, if you're about to have cataract surgery, some of the most recent studies show that before they do those lens implant measurements for the intraocular lens implants, there was a study that shows up to 40% of patients had to have those lens implants recalculated after they treated their dry eye, because it affects the vision that much. So you want to treat it before. We're finding this now. So I'm working with a lot of cataract surgeons to try to get those patients' front surface of their eyes stabilized beforehand. So if you had cataract surgery, don't feel bad, but I do want to put that out there for everyone. So thank you for bringing that up. But yes, all those other risk factors too, postmenopausal, low thyroid. Remember, I said there is a systemic condition. So some of those, getting the systemic condition under control is helpful. And I think one thing that a dry eye specialist would do, like myself, would be to just make sure that you're asking those extra questions. Where are we on the thyroid problem? Are you seeing someone? Have you had your thyroid levels checked? Is it autoimmune based, like a Hashimoto's? What are we doing there? So following up with you and making sure you're keeping those systemic conditions under control and getting to the right provider who is listening and kind of monitoring that properly. Because if you have an underlying systemic issue, that they can only do so much for you on the front surface. You got to take care of your whole body first. Secondarily, about the hydration and the blinking. And so I think we learned today, hopefully, that's important. Regarding specifically, though, what your eye doctor is prescribing, your eye doctor did a good job, I think, as far as it's what most primary eye care providers do. When you go to your eye doctor, that's what they'll do. So you mentioned a prescription drop. There are now 4 on the market, specifically for dry eye. Restasis was the first, Xiidra was the second, Cequa was the third, and then Tyrvaya was the newest. It's actually a nasal spray. Those all have their place. They're very important, and they're used at different points in therapy, but they're for specific things. I think the most important thing for patients and doctors to understand, patients, I think, really, is that there's no magic bullet, no magic cure for dry eye, in the sense that, I mentioned that there's oftentimes several conditions at once, 3 to 4. We need to address everything in addition to the whole person. And so for the longest time, people just wanted to put in the punctal plugs to stop the tear drainage issue, the tears draining too fast and increase water. Well, we've backed away from that. The plugs have an important role. Same thing with Restasis and these other medications. They are very important. They're very effective, but they have to be prescribed at the right times and for the right reasons. And sometimes for patients, it's right away, but not necessarily for everybody. It's different. It's case by case. So anytime they say they start a medication and then kind of back off of it, oftentimes the doctor is learning more about what these can do for patients, but you have to stay the course with some of these medications. If you were on one of those medications, they burn, they sting, which is frustrating, because that's why you're going to get it fixed. You're going to get, how your eyes feel fixed. And then your doctor puts you on this drop that burns and stings, or Xiidra tastes really bad, so your doctor has to prepare you that that's a minimal side effect, but we're working through a healing process, and this drop works for a particular reason, and they need to monitor you on that drop. So those drugs do very specific things in the dry eye world. In particular, they act on the water layer of the tear film. And so your doctor needs to be monitoring that. And you wouldn't know that as the patient, but just so you guys know, be careful if you go to someone and they're like, we're just going to put some plugs in and we're done, or we're just going to prescribe the strap and be done. Your doctor didn't do that. She prescribed several things. So I think she was trying to take a whole view approach, and it sounded like she really spent a good time with you. Those drugs are legitimate. They have their place. As far as omega-3s, absolutely. So now we're getting into the home therapy regimen, and the fundamental home therapy regimen for dry eye. A lot of doctors will go straight to drops, and that's again more for feeling. But I think the number one cornerstone is omega-3s. So for all you out there, most people are on omega-3s. If you want to get out your pencils and pens, I'm going to give you exactly the criteria that you need for good omega-3, a good omega-3 that will help your eyes. In order that not all supplements are created equal, they're not regulated by the FDA. They're not all going to help your eyes. So just because you're on omega-3, it's not going to necessarily do something. So for omega-3,
Patricia can drop this in the chat too.
Yeah. So omega-3s are critical. And number one, you've got to have the right dose. So to help your eyes, we need 2,000 to 3,000 milligrams of omega-3 daily. And this is fish oil, not krill oil, not flaxseed. Okay. 2,000 to 3,000 milligrams daily. So it's got to be the right dose. It's got to be the right form. So there's two forms, the triglyceride form and then the ethyl ester form. And you want it to be in the triglyceride form. That does not affect your triglycerides in a bad way. It actually helps your cholesterol levels, because the triglyceride form helps your body to absorb these supplements better. Okay, so it's got to be in the triglyceride form, and it'll say it on the bottle, triglyceride form somewhere. Okay, careful, because these, in order to do that, that means only 50% has to be in the triglyceride form. So still, you know, if you're using it for a good 8 to 10 weeks and we're not getting an improvement, then we're going to want to maybe switch to a better medical grade brand. Okay, so dose, form, and then you want to look at the ingredients. It'll say EPA, DHA, and it'll say other omegas. If you're looking at your bottle, you want to make sure that the majority of your omega-3s are EPA and DHA. And for your eyes, you want more EPA than DHA, according to the studies. So that's really getting in there. The two brands that are best well known for eye care are Nordic Naturals Pro Omegas, the professional brand, the Pro Omega 2000. So it's over 2,000 milligrams daily. And that brand is 90% and over 90%, it's like 93% in the triglyceride form. And it's amazing. The other brand that's really, really good is called PRN D3, or physicians recommended nutraceuticals. It's wonderful. So omega-3 supplementation is the cornerstone. There's also some other supplements for dry eye that are very helpful. I'm not going to get into that because we have other things to discuss, but there are some others that can be very helpful, especially if you have autoimmune conditions, inflammatory conditions like Sjogren's, rheumatoid arthritis, and that type of thing. So it's foundational cornerstone. In addition to the home therapy, so we have the omegas, the lid hygiene, that needs to be a part of everybody. So at the very least, like washing your face, making twice a day, making sure you're doing that gentle mechanical rubbing, removing any debris, removing any makeup, and then if you wear it, and then also just getting rid of that, any kind of bacterial overgrowth on your lids and lashes, using that hypochlorous spray as protectant, or if we have blepharitis, and usually blepharitis is almost always that Demodex, using something like a Zocular product, the ZocuFoam or ZocuWipe is very helpful. So omega-3s, lid scrubs, warm compresses you mentioned, those definitely have a place. I'm a little more strategic about when I implement that into the therapy, but definitely it's always considered part of the dry eye regimen. You actually need to be using moist heat, not dry heat. So those little bead rice packs are pretty good for actually providing a moist heat. It can affect the skin around the eye area if you're just doing dry heat. So if you have something else and doesn't have like a moist heat, just take like a paper towel and spritz it with some water and put it underneath your hot pack. It needs to be 15 minutes of continuous moist heat daily, at least once. And afterwards, doing some blinking exercises to get that oil flowing. The glands are running, the openings of the glands are around the eyelashes. So afterwards we gently roll down towards the glands here. or we roll up towards the glands on the lower lid, and that can gentle, and we're not pushing, but we're trying to kind of move some of that thickened, hardened oil out. My favorite go-to heat mask is also by iEco, because it's called the Tranquilize Advanced XL. It's a large heat mask that goes around the whole brow bone, and it has a gel pack that goes to 10 degrees above body temperature. And that's the standard heat that we know in studies that actually reheat that oil and helps that oil to reliquefy. So everything I do in my office is evidence-based, based on the literature. So your doctor is absolutely right, like, you know, addressing the omegas, the lid hygiene. Drops, again, we're kind of moving away from that as our, you know, we want patients to feel comfortable, super important in that, but I just tell patients use them as needed as long as it's preservative free. My favorite drop on the market right now, there's a couple, but top choice is Optace Intense Dry Eye. It's excellent. There's a couple other good ones out there that are really good. The Retain MGD I've used for years. I use that off-label with contact lenses. Some patients use it with their, with or without. Another really good one out there is Refresh Relieva. Refresh Relieva is really good. Another good one out there is the Refresh Optive Mega 3. So there's a lot of Refresh brands, but those are two of the newer ones. So it just depends on what's going on. So I prescribe those. They all have, I actually research all of the active and inactive, I'm a geek. I research all the active and inactive ingredients of all the drops on the market. And I prescribe even those over the counters based on specifically what's going on in your tear film, in your eyes. But just generally, if I would say a good one, I would say Optace is hands down one of my favorites. There's a new one coming out of Europe really, really soon. It'll be even, I think, maybe a little bit better. So we'll see. It's not out there yet. So hopefully that helped.
Thank you for your questions, Kathy. And now on to our next VIP, Laura. Hello, Laura.
Hi, Laura.
Welcome.
Hi.
Hey, sorry, I just had to get unmuted. So I have a good lifestyle and I hydrate well. Is this something that would be detected by a regular old eye doctor during an annual exam if you had an issue, or not necessarily?
That's a great question. Every eye doctor, optometrist, and ophthalmologist should be able to detect and treat dry eye. It's just a matter of kind of what their emphasis is. You know, there's a lot to address during a comprehensive eye examination. And most of the time patients go there, you know, if you go to an optometrist, they're thinking more glasses and contact lenses, or if they go to an ophthalmologist, they're thinking I have more of a medical problem. But either way, both eye doctors you know, general for your comprehensive eye exam, they have to hit the same key points. They have to do the same things. And again, all of them can diagnose and treat it. Some ways to know if they're into it and have kept up on some of this latest research that I've been discussing here today. If you go to their website and they talk about it, it's one of the most common things we see in our world. And it's one of the hottest topics in eye care right now for surgeons and optometrists alike. One of the ways you can tell, not just on their website, if they've implemented a survey. So that's a key. So there are some surveys, a quick like one pager that they'll put on their paperwork, the new patient paperwork. So there's one called a speed score or speed survey. There's one called a DEQ, which I use, but it's a survey that asks you some screening questions about dry eye. There's several different ones out there, so those are just two popular ones. But there was a major study that was done in 2017, and this study kind of redefined dry eye as the disease, and again, talked about a lot of things I've discussed here today, but they've also, it was a 400+ page study for doctors, kind of telling us how to diagnose it, how to treat it, and at just that basic primary care level, how to screen for it. In the survey, they actually considered kind of a standard of care. implementing those questions and asking patients those questions about their eyes. And then also there's some additional testing that they can do on patients in office. So, but you should be getting asked about it. Just about every office should be asking you, and kind of see, you know, if you have questions about it. It's interesting. I've had a lot of patients just not bring it up because they're like, oh, it's Arizona, my eyes should be dry. Well, no. So if your doctor asks you, tell them what you're experiencing with your eyes. They want to know. So
I'm going to be in Arizona later this month.
Oh.
Do you do regular eye exams, or is it only if?
I don't do regular eye exams anymore, unfortunately,
Okay.
but my colleague literally next door to me, he does, and he's fantastic. And, you know, I actually work in conjunction with eye doctors. They all, you know, send patients to me. So I'm not in competition. You know, I do what I do.
Yeah, no, I understand. I just, since I was going to be out there, I just thought I'd ask.
Yeah.
So then in regards to the omega-3, I've been told I would do best with the algae-based omega-3.
Mm-hmm.
So is that not going to be as supportive of the eyes as the others?
Great question. So the component in that one is slightly different than the EPA and DHA. If you can't take the actual fish oil, that's great for people who are vegans or have fish allergies or sensitivities. You do have to take a higher dose though. So kind of look at the dosage, because the dosage of that component is a lot lower. So again, we want to make sure you're in a much higher dose, that 2,000 to 3,000 range. Both brands that I mentioned, PRN and Nordic Naturals, do have an algae omega version. And so on my patients, I usually at least double that version, what the recommended dosage is. Great question.
And I definitely have never washed my eyes. I also don't really wear makeup. So, you know, definitely if I had mascara on, I would want to wash it off. But I thought we weren't supposed to rub our eyes. So I'm a little bit, I want a little bit more of details on how we're supposed to be rubbing our eyes and the eyelashes to clean them, because I don't know how to do that, even though it's
great question.
You're showing over like this, but you're not actually touching your eyes. And I just would have no idea what to do.
Great question. And you're not alone. I started asking people that, and there's a lot of people that don't wash their eyes or touch their face. Yes, you're right. We're not supposed to rub our eyes as far as like grind them or rub them really hard. But when I'm talking about cleansing your eyes, I'm going to get a little closer here. I don't know how close you guys want me to get, but you're going to close your eyes and you're going to get to the lids, and in this gentle circular motion, just touch the lashes and really get in there. And so for patients, I even have them close their lid and just roll upward, and you can see under here where my makeup is, that's my lid margin. And I can get in there and just gently, in a gentle circular motion, just kind of at the base of the lashes. It's gentle. I'm not rubbing or grinding. That can, like a real rub or grind, even if your eyes are itchy, think of like the allergy kind of like, oh, I'm just rubbing my eye. That we don't want to do, because that can actually damage the corneal surface and create those damage or dry patches. It can also, if you're really pushing on your eye, you're technically pushing on the retina. So you don't want to do that, but it's just it's just real gentle, just kind of like, you know, you're just kind of gently like rubbing along the skin, you know, just to cleanse it. You know, you wash your hands, you don't have to do that. You know, there's a different level of pressure.
Right.
Does that help?
Yeah. And, you know what, I'm not sure if I'm pronouncing it right, but chalazion.
Yes.
On the eyelid, under the bump underneath the eyelid is, do you know what causes that?
Yes, good question. Gosh, I swear I didn't pay any of you guys or prompt any of you guys. These are all great questions. So a chalazion is also related to something called a hordeolum or a sty. And what patients often know as that. So for the rest of you guys, that's when you get that bump on your lid that's swollen, painful, tender to the touch. That actually is directly related to what I'm talking about today. So that sty or that hordeolum, some doctors call it a chalazion. That's a later stage when it's all not as swollen and inflamed anymore, all kind of the same thing. It's that oil gland I was telling you about earlier, those meibomian glands. One of those glands have become obstructed. Okay, so remember the oil changes and it becomes thicker. Well, one of those glands has become maybe not blocked all the way, but thickened and obstructed, at least partially. And bacteria from your lids, which we've also been talking about, got into the right place at the wrong time and started to create that little local infection. So that it's a little infection of the oil gland. That's what it is. And so it's directly related to all these conditions. So if you've ever had those, it's not a bad idea. It's not a bad idea to definitely implement the omega-3s, bump up your regimen, make sure that you're taking the adequate medical grade ones, that you're washing gently. And again, that's breaking up. It's real gentle. Like if your skin is moving all over the place, you're doing it too hard. But if you're doing that, it can be very, very helpful in preventing those. The hypochlorous spray, that will get rid of what we call the biofilm or any of that bacterial overgrowth. If you've ever felt the bottom of a dog bowl, like slimy, that's a biofilm. You can get that on your lids and lashes, and we see that a lot. And so that hypochlorous spray just makes sure everybody has bacteria in our skin. Tears, we don't like to think about it, but we do. That keeps all of that at bay. So if you're prone to those styes, doing at least the omega-3s and the gentle lid cleansing will be helpful. Warm compresses are the mainstay treatment for that. But if that keeps happening, or if the entire lid swells, that can actually become an emergency. So again,
yeah, no, I just had one recently, and and it wasn't a sty, because sty is red and on the edge of the lid. It was underneath. It was a bump where you could just see it on the surface, not on the edge of the lid.
You can actually get them all the way up underneath, or on the edge, or on the top. So they can.
Yeah, mine was underneath on this on this lid. But I was more concerned about it because of my sister, who's only a year and a half younger than me, that lives in France. She just had to have surgery to unblock it. And then it didn't work. So she had to have a second surgery to unblock it. So I'm like, dang, I thought it was just going to go away. And mine really has resolved. But so based on that one symptom alone, does that mean I might have? Yeah. I mean, I'm hearing all the things I should be doing that I'm not doing. So that's great. But does that indicate that I might have some level of dry eye or?
Yeah.
Okay.
And remember, again, it's a totally different understanding than what's out there. This knowledge is not out there in the general public, but this is the most common conditions. A lot of times patients don't feel it. We can have a lot of damage going on and they just don't know. So at our continuing education conferences, they teach doctors now, all your patients are considered dry eye patients unless you can prove otherwise. And if you had a sty or a hordeolum or a chalazion
is what I had. Yeah.
Then you had at least one blocked gland, and usually where there's one blocked gland, there's many. So
yeah, well, I've had at least, because I had to look it up. I've had a chalazion before. Not very frequently, like maybe over a 10-year span, 2 or maybe 3, but no more than that. But yeah, so now if I can't prove that I don't have dry eye, would it be worth trying to see you in person if I can?
Yeah, absolutely. Okay. Yep.
Cool.
And these are medical conditions. We bill that all to medical insurance. So thank you.
Cool. All right. I think that.
And Laura, Alli does the dry exam, but as you can tell, she's a wealth of information. So if you go in sorry, Alli, but if you go in for her dry eye exam, she can't help but be like, oh, and like start looking at everything. That's just the way she's just extremely thorough. So yeah, if you're in town, I highly recommend you see her. It's a great idea.
Cool. Yeah. All right. Thank you. Thanks for answering all the questions. I appreciate it. Thanks for coming on too. Great guest, Robbie.
Oh, absolutely. Only the best for our VIPs and our Full Body Fix audience. So we are going on to Jean next, but I just want to make a quick announcement because I know we're running over. So for our next Full Body Fix, Patty, jump in and tell us what the date is here in a moment. But for our next full body fix, we are going to have BJ Fogg, a Stanford psychologist who's really, really awesome with behavioral change and habits and how to get, like exactly that habits that Dr. Hoppert is talking to you about and implementing in your life. Like, how do you make that the easy? How do you remember to wash your face? And because it sounds easy when we're here in the show, right? Like, but, actually implementing that and making that a behavioral change. And Jeff drinking more water, right? And all of us have something, right? Me going to bed earlier, Randa, Haynes, and I are in the same boat that, we need to go to bed earlier. We all have something, right? So BJ Fogg is an expert on that. He will help us get that, whatever that thing is, in motion and change our behavior. So that's our next full body fix show. Patricia's dropped the link in the chat. We are going to continue with these awesome knowledge, wisdom bombs that Alli's sharing with us here. And our next VIP is Jean. Hello, Jean. Welcome.
Hi. First of all, thank you so much for all these wonderful, wonderful tips. My question is, what do you think about using castor oil eye drops for dry eye?
Castor oil eye drops. I've heard about castor oil as far as one of the more out of the box things for lash regrowth, actually. Drops, I haven't heard as much about. And the thing is let me just put it this way. Anything you put, remember, dry eye truly occurs when there's a disruption to the tear layer. So you want to be careful. Anything you put in your eyes that can disrupt it, even regular drops. We want to make sure that if we're using them, that the benefit outweighs the risk of it. So I'll be honest with you, I don't have any research based on castor oil drops. So I won't say either way, but it's not something that's I will say it's not talked about in the upper dry eye echelon. And I try to go to every continuing education, any dry eye doctor in the country that's speaking. I will be there in my home office here on a Saturday morning listening to them talk. So I haven't heard the drop component, but the lashes, brushing it on the lashes can be a natural way to help with lash regrowth if we're having some lash issues. And lash dropout or loss can be due to that Blepharitis or Demodex that we were talking about earlier.
Okay, well, I've had dry eye for many years, and I was using the commercial refresh and all that. And then I read that the more you use it, the more you're going to have to use it. And so then I started looking into other alternatives. And then I also was trying to prevent or try to be proactive about not getting cataract surgery. And then I read that castor oil drops helps to prevent that, whether it's true or not. So I talked to my ophthalmologist and said, I would like to try using castor oil drops for dry eye and also as a cataract prevention. And like you, he said he hasn't read much literature about it, but if I want to try it, go ahead. So I've been using it for the last 2 years, I would say. And when I went for my last eye checkup, my cataract risk was still mild. So it hasn't deteriorated. It hasn't improved, but it's still remained the same. So, and it seems to soothe my eyes when I feel that it's a little bit dry,
My sneaking suspicion, what's going on with that? Because if it's an oil base, remember the roof of a tear film is oil. And so I agree with you. A lot of the drops on the market, a lot of them don't do too much. They just kind of wet your eyes a little bit.
Yeah.
The ones that I recommended earlier have some specific components. Most of them are actually in their inactive ingredients that are helpful, but for specific reasons. The Retain MGD and the Refresh Optive Mega 3 have an oil base to them. And the whole purpose of adding a little bit of oil back into the tear film is to help with that evaporative dry eye. Again, 86% of adults have been shown to have problems with those oil glands, plugging of it or the changes in the oil. So Drops that have a little bit of oil to them can be very helpful and soothing for patients. So my guess is that's what's going on. Again, I don't have any proof or I haven't seen that in the literature either way, but an oil or what they call emollient-based drop is helpful for that reason. As far as the cataracts go, the most common form of cataracts can take a long time to develop. So I'm glad it's not getting worse for you. There are some drops that try to claim that on the market. I'd be a little leery on that, but as far as I'm not surprised that you're getting relief from it for those reasons.
Thank you.
Yeah, thank you. Great questions.
Okay, and now we're going to go on to our VIP questions in the chat, and then we'll go to our open audience members. So Patricia, please help me make sure we don't miss anybody. So Mary Claude, Patricia posted that in the chat is what is the eye drops. So it's the Optase, and I actually personally use Optase. Dr. Alli just recently turned that on to me. Let's see. Lena had a question from earlier. She had to leave, but we can share the info with her.
Darren,
Karen,
I have the questions on my. Okay, so let me read. Hey,
Okay,
Dr.
thank you.
Allison. This is from Darren. Is there a condition when you go outside in cold air or windy conditions and your eyes are constantly watering? Is there something that can be done to help reduce this?
Yes. So remember how I said dry eye causes three things. It causes damage, inflammation, and nerve changes. So that's the corneal nerves. So you can either be sensitive to light or you can be sensitive to wind. And one of the responses is that light sensitivity or pain or watering. So you can have very watery eyes and actually have really dry eye. So if you're having trouble with really windy environments, yes, that's a risk, an environmental risk. There are some glasses out there, some sunglasses. If you even just like a normal wraparound can be helpful, but there are some that actually do seal all the way around. So even like if you have a severe trouble with this, there are some even like motorcycle glasses that you can get and have made that actually fit all the way around, wrap around and seal and block the wind a little better. But healing and soothing those corneal nerves can be very helpful. And that does help. Lubrication does help that one. And trying to also find the root cause of the stimulus that's making those corneal nerves sensitive. So is it, what type of dryness is going on? Are you not blinking enough? Are you not sealing your lids enough? The root cause has to be determined, but those other things can help.
Another question, Dr. Alli. Will Latisse increase dry eyes?
Good question. So Latisse is the original product that is prescription for eyelash growth. And Latisse came from a glaucoma drop, actually. It works very well. The major side effect of this, it's brushed onto the lashes. The major side effect of this is redness and irritation, just like the glaucoma medication it comes from. So Latisse in particular, and most lash growth serums will cause some pretty substantial irritation and inflammation. So you do need to be careful, definitely not to get it in your eye. But if you are starting to experience some side effects of redness, discomfort, and kind of overall dryness, try stopping the Latisse or some of those other lash growth serums and seeing if that helps. Good question.
And a last one. Electric heat could cause dry eye.
Electric heat. Do they mean like in a hot pack? Like there are a lot of those eye masks out there. You see them all over Amazon and other places, even like I think Sharper Image. They have these electric heat masks that you can plug in. Some patients love it, but be careful. Again, we want moist heat. That's a little bit better for the skin around the area too. In the dry eye circles, we talk about how dry heat can actually cause some wrinkles. So nobody wants that.
But, but it's in the house, the house heat.
Oh, the house heat. Oh, like, Yes. So anything that would cause your clothes to dry on a clothesline, wind, forced air, high heat, and low humidity can cause dry eye. So if you have, especially if it's blasting, yes, it can be causative of dryness.
Thank you.
Mm-hmm.
So, and then did you see Lena's question, Patricia? This previous in the chat. She asked about Irene, like her friend wears these colored lenses called Irene,
Oh,
and
yeah.
she was asking if this is a good thing to do. I don't know if you're familiar.
Colored glasses called which?
Contacts. She's saying I think if I find where it was in the chat, here's IRENE.
Erlen's lenses, I think. That is more in like behavioral, kind of another specialty within eye care. And in this question was what in particular?
Patricia, can you find that question in the chat?
She says that she has a friend who uses colored lenses, iron, and that's for light sensitivity. And if you're familiar with this method and your thoughts.
Yes. Okay. So with light sensitivity, absolutely. Remember, with any of the symptoms you have, you can always do something like a bandage to help you feel a little better, but you still want to get to the root cause. So yes, you can use colored filters, and there's different brands of them out there. You can even in your optical, you can ask when you're getting your next pair of glasses, they'll have little most of them have little tinted lens samples. And you can ask to see, like looking outside or looking at the computer, if it makes your eyes feel a little bit better with a tint or with the anti-reflective coatings or blue light filters. Those absolutely can help as well. We didn't get to, I know we wanted to talk about that. We didn't really get to talk about that today. But those things, the blue light filters, usually in the form of an anti-reflective coating or subtle tints, can be very helpful for light sensitivity, but that's again more of a bandage. It's not the root cause. So definitely part of the package to again make you feel overall better, but not fix, if that makes sense.
Yeah, makes total sense. Okay,
and that's so person dependent. Which filter helps who? Okay.
We're gonna have you back on, Dr.
Alli.
We didn't even talk about blue light, and there's
didn't even talk about blue light.
Cool stuff about how you can tell which light your lenses actually block by just looking at them. Yeah. And actually we should talk about that just briefly. So and we have two more questions. So we have two more questions. Our last question of the day is going to be Janie and also Ty. So our last two questions of the day will be Janie and Ty. And then so this is very interesting, right? Because blue light is a big discussion. It's all around us. And you know, I always use my big ring light for all of these type of presentations, which is a lot of blue light. Normally I have my glasses on, and, you know, there's all this talk about the yellow lenses, and, you know, everybody's like, oh, the yellow lenses are everything, right? And a lot of people wear the yellow lenses, but then when you and I talked, you're like, well, not necessarily. Like, you know, there's actually lenses that aren't yellow that can be even better. And then you talked about, actually, it's not the blue light, it's the violet light. Actually, the violet light's the worst, and most people aren't even talking about that. So without getting into a whole separate section.
A whole other series.
Yeah. Can you give us the cliff notes? Because it is really important for us all to know.
Yeah. So yeah, absolutely. I guess the cliff notes on that. So blue light, it's also the medical term we call it is high energy visible light. It's really close in energy to UV. Okay, so UV we used to think could get to the back of the eye and damage the back of the eye. Blue light, UV can't. Only about 3% of it can. So very rarely does it get all the way back there. Blue light though can. And so blue light comes from all light sources. The biggest light source is actually the sun. The reason we care about digital devices though is because we're constantly exposing our eyes. Think about this. Up until like the iPhone was invented, we weren't having light shining in our face constantly, but now we do. So just protecting our eyes using the proper filters can be helpful. Blue light has 3 in the realm of eye care, the Cliff Notes, blue light can affect the eyes in 3 ways. One, there's some school of thought, could it potentially be leading or contributing to macular degeneration, where we used to think UV was the big problem. So in the back of the eye. 2, do we care, or is it affecting our sleep cycles? And that you probably hear a lot about in the news, and yes, and Apple's even addressed that with some of their filters on their phones. And then 3, the third thing that blue light can do is it can cause visual fatigue, so very tired eyes. And that's because the blue light comes to a focus right in front of the back of the eye, right in front of that retinal tissue. And it makes that poor little muscle I mentioned earlier that in the focusing system just work in overdrive to try to clear it up. And so that's the effect that digital devices have on our focusing system. So 3 things that blue light can do to affect the eyes and vision. There are a lot of blue light filters out there. You want to be careful because, and again, I don't own an optical, so I don't get any kickback for this, but really you want to use good optical grade lenses or filters. So a filter can be a coating, it can be a tint, but you want to make sure you're checking out your resources wherever you're getting it. Yellow, for a long time, those are called blue blocking lenses, and they've used those for years and years. Even just in like hunting and fishing, you can get those at like, stores that sell hunting and fishing equipment to block, help with contrast actually, and help with certain light levels, but they don't all do the same thing. And so the big key is that again, if it's not regulated by the optical industry, it's not regulated. So there's, advertisers can say a lot of things, but you want to make sure you're getting good quality filters. And it can be a coating, it can be a tint. There's a lot of different things out there, but do your research. Be careful. Don't get taken advantage of there. There is real science behind it. And it can be very helpful. My favorite for patients, when I was still seeing patients for primary eye care exams, I recommended an anti-reflective coating that had blue light protection on every single pair of glasses for everybody. And again, that was for those 3 reasons that I mentioned. So I like the anti-reflective coating because it doesn't change the color of your lenses. So some people don't want to walk around with the tint for the cosmetic effect. But the other thing, you guys, be really careful if you're driving in these lenses. Even if you see 20/20 at your normal eye exam, just being in the dark and dim lighting, if you have good vision, being in the dark and dim lighting, your vision naturally drops to about 20/30 at night. That's 2 lines. And if you add any colored or tilted filter or tinted lens in front of that, you're dropping your vision further, even if it's yellow. So there's a lot of yellow driving lenses and things out there. Be careful. You want to make sure that you're not diminishing your acuity below a safe level, because 20/30, again, if the normal person walks around 20/20, they're 20/30 at night. Most states' driving standards are 20/40. So you don't have a big area to play in, with that. So.
And we can simply just look at the lens and see which light is being reflected off of it.
Yeah, so that's the anti-reflective coating I was showing you in Optus. So if you have most of us now have anti-reflective coatings on our glasses. And if you want to know if yours protects you from blue light, take off your glasses and look at the light reflecting back at you. Most of the filters will have some kind of color tint to it. Some anti-reflective coatings don't, but most do. Most of the average one is a greenish color that's reflecting back at you. If it's reflecting it back at you, that means it's blocking that light wavelength. So for blue protection, you want to get kind of a blue violet tinge kind of reflecting back at you, not the greenish tinge. And again, to order that in your optical, you just ask them about all their blue light protection, ask them what it is, and ask to see it. There's usually a range of things to try.
Awesome. And Jamie, let's go on to your second to last question of the day here.
Wait a sec. There we go. Okay, so yeah, you just covered a little bit of stuff. My glasses actually reflect green, so I guess I'm going to have to look into that because my eyes have been really, especially my left eye, which is doing the most work. It's the strongest eye. It's actually like 20/20, but it's become double. So it has a double or triple. So, and I started looking into this dry eye thing. My eye doctor never said anything to me about dry eye. And I'm kind of upset about that because I've had this issue for at least 3 years and it's slowly getting worse. And when I look at my cell phone, it's really bad. If I look at my cell phone too long, like more than 5 minutes actually, then it'll be all double and I'll have to kind of look away, do some exercises, you know, blink a lot. And then I might be lucky if later on in the day my eyes kind of go normal. But because the left eye is my best eye, it sees the furthest, everything is double. Everything's a little halo. So I'm trying to figure out if it's already too late or if I can actually reverse that or figure out what to do about it.
Well, your double, this is important because now that's a really good point to bring up. I'm glad you got on and asked me this question because my job is as a doctor is to determine, is this a vision problem or is this a medical problem? So first of all, when you're double, do you close one eye and it gets better?
Right. The other eye isn't as double as the right eye is not as double as the left eye, but the right eye has a congenital cataract on the lens, so it's kind of blurry.
Okay. So if you close your right eye, you're double and triple in your left eye if your right eye is closed.
Yeah, if I look at a light at night or something, like if I look at the stars, I'll see 3 times as many stars.
Okay.
So
there's some different things that can cause that. The tear foam problem, like in dry eye, can like worsen vision quality, but it's not going to cause actual doubling. So usually if it's in both eyes, that's an eyes working together as a team problem. So if you close an eye and it gets better, then we know it's an eye teaming problem. If you close an eye though and it's still there, then we're going to worry about an eye health problem. And I wouldn't think dry eye is number one there. It can contribute, but I would be most commonly it's cataract. It can also be astigmatism, and astigmatism usually is pretty stable at this point in life. So it can be, we need to figure out what's changing. If there's something going on the corneal surface, can sometimes be retinal too. So make sure you talk to your eye doctor. If you have double vision, any of you, make sure you talk to your eye doctor and kind of note like when it is. Is it with or without the glasses? If your glasses fix it, that's good, but if it's with your glasses and you want to know if it's in the distance or up close, you want to know if it's happening with both eyes or just one eye and like when you're experiencing it. And if you can kind of like keep track of those things, bring that into your doctor and definitely talk to them. This one dry eye could be worsening, but I don't know if it's the cause of that one. So get that looked into. Make sure you talk to your doctor about that.
Okay. Thank you.
Yeah.
And next up and last, but certainly not least, we have Ty. Good day to you, my friend. Welcome. Great to see you.
Ty.
Hey, thank you, Robbie. And thank you, Dr. Alli, for being on the show. I'm an ex-military combat veteran, and I have something called ocular hypertension, which is treated with glaucoma drops. Let me see if I can get this mic here. And the problem is, I have what they call chemically induced dry eyes. So how do I fix that?
You are absolutely right. Every glaucoma patient is a dry eye patient. So if basically whether you have true glaucoma or you have your ocular hypertension and you're taking those medications, unfortunately, we need to make sure that those pressures are under control so we can, make sure your vision is safe and protect the health of your eyes overall. But, one of the major side effects is that redness and irritation and dryness. And you're absolutely right. Those are very disruptive to the tear film. So, yes. So with those cases, I always tell patients, it's important to understand we never want to go off the medications. You always got to first go with what your glaucoma specialist directs. But then we got to manage it together, and setting expectations, knowing that when we have those underlying conditions, we're not necessarily going to be able to cure it, but our goal is to now improve it, get it managed, get it to where it's not as bothersome, hopefully for you, get you on the right products based on what's going on with your eyes, or doing we have lots of in-office treatments and procedures I can do as well that help. But getting you comfortable and manageable so it's not so bothersome, and you can stay on your glaucoma medications. That's what's important. So again, we still treat our glaucoma patients the same way. We just set their expectations when you have an underlying eye or systemic condition. We still talk about the importance of certain types of home therapy, office treatments, lifestyle changes, and monitoring. So those are still fundamental for you as well. As far as there are some things, if it gets to be unbearable, because we don't want you that uncomfortable, depends on the drops that you're on. There are some preservative-free glaucoma medications, and if at all possible, you can talk to your doctor about that.
Yes, that's what happened. I went literally from A to Z, I'm sorry, to get to the right prescription, and one was without the preservatives, and that seemed to work for a while.
Yes. And that's a good testimony right there to everyone who's using preservative drops, but especially those glaucoma medications. Never take yourself off a medication. Again, those are important. They keep your vision safe, but make sure that you talk to them about that. In certain cases that are very severe, there are some surgical procedures. In the United States, we don't go to surgery first. We do medications first, but there are sometimes, depending on how bad the patient's suffering, there are sometimes trying a different surgical procedure instead, so that the patient doesn't have to use as many drops, or as often, can be helpful as well. But again, that's something that your glaucoma specialist would have to spearhead that one. So making sure though that you're I would say, if you haven't found a dry eye specialist in your area, specifically for your case, find somebody who's really passionate about dry eye, who can work with you and help you to monitor your ocular surface, because the healing process, again, it's affecting those nerves. So somebody needs to help you see where you're at and make sure that your tissues are actually healing.
Great, thank you.
You're welcome. Good luck to you.
Thanks, Robbie.
You're so very welcome. Only the best for our VIPs and our Full Body Fix audience members. So awesome to have all of you here. It's been an excellent show. So super grateful to you, Dr. Alli, for being on the show with us and sharing your wealth of wisdom and true improvement in an area of our body. All body areas are important, but arguably, I don't even myself, like eyes, there's really nothing more important than your vision, right? And so thank you, truly appreciative for you and the wealth of wisdom you've acquired in your life, and for the blessing that we've all had for you to share it with us here. And I could definitely see us having a episode 2 of this, because there's a lot of questions, and I think our audience members will come back with even more questions. So
I saw so many in there, and I was like, questions about surgical procedures and lid procedures and other eye conditions and shingles and all those things. Yes, all of this is all linked. So I'd love to come back. Thank you so much for having me. Thank you to the VIP members and for staying and listening to each other, because you can learn a lot from your peers. And thank you again. I appreciate you.
Dr. Alli, and how do they do if they want to connect with you? Is through your site?
Yes, absolutely. So my website actually has an online scheduler. So you can, the online scheduler would be for in-person. If you are interested in a telehealth visit, you can actually text my office. My office number is 480-485-6403. That's 480-485-6403. And we can just say that, you know, your name and that you're interested in telehealth, and we can get you on a list. My name of my office is Individualized Dry Eye Center. And again, we're in Phoenix, Arizona. So here to meet all your needs on dry eye. And so hoping to do an outreach. Like I said, telehealth. I'm actually a part of a lot of dry eye chats, and even around the world, there's a lot of patients that really suffer and don't have access. So just kind of going over your personal cases as we're seeing here today, there's a lot more I can do for you if I know all of the ins and outs of your history. Always best if I can see you in person, certainly, but even having a consultation can be helpful.
Definitely. Oh yeah. Yeah, absolutely. With your wealth of wisdom, if someone's already seeing their own doctor, the guidance that you can give them will actually enable them to get even more out of the doctor that they are working with. So I would highly recommend that if you can't make it out to Arizona. And Patricia has dropped that contact information for Dr. Alli in the chat, so you can see her clinic information as well as her direct, she's actually provided her direct office text line, so we can actually text her office and get back a response from her and her staff. So much love to you. Make it an amazing weekend. And for our VIPs, we'll see you back in training on Monday. Be healthy.
Bye.
See you soon.
Thank you.
You're welcome.
Bye.
Thanks, Robbie, Patricia, Dr. Alli.
Robbie, you're so very welcome.